Well, I think the biggest challenge is to make sure that we get policymakers solving the right problem. And we need to give policymakers tools to really generate long-term sustainable savings in the program. So we're spending time identifying interventions and programs that work, trying to find ways that make them replicable and fastly scalable in the program so that policymakers can focus on really redesigning the system rather than simply having a budget discussion about cutting payment rates to healthcare providers.
I think the biggest challenge for our current Medicare program, which really is the largest health program covering millions of Medicare beneficiaries, right now it's more of a sick program rather than a wellness program. And so we really need to shift how Medicare pays for its goods and services from what we call a volume-based system. The more you do, the more you get paid. It doesn't really look at the outcomes, doesn't really look as much as it should at the quality of care being provided to Medicare beneficiaries. So we need to make a big transformation, a big shift. It's one that is already underway, really moving that Medicare program towards what we would call a value-based system.
One of the things that I'd like to raise that is potentially challenging is that when we're faced with difficult decisions in the political process, we tend to either make drastic cuts or avoid things completely. And what we'd really hope to see as part of Medicare reform is not something similar to the solution that came up with cutting appropriations through sequestration and not see draconian cuts to the program because we've either punted the football too far down the road and not been able to find common ground. We really would like to see this be something that's taken up seriously now, and if there is a long period of debate, we think that that's fine, but we think it needs to come to some positive bipartisan solution.